Hey everybody, I'm Dr. Matt Sherwood with Sherwood Spine and Sport. Today I'm going to be going over golfer's elbow, which is pain on the inner aspect of the elbow, also medically known as medial epicondylitis. Very similar to the last video I did, which is tennis elbow, which is pain on the outer aspect of the elbow. The muscles attaching to the inner elbow are going to be flexing the wrist, or pronating the wrist, or rolling down, or pronating the elbow. So any activity we're doing where we are repetitively straining those muscles, that's gonna lead this condition. Initially, you're gonna get irritation, strain in the muscles, then it's gonna pull at the bone long enough, then the bone gets inflamed there. So anything where we're gripping really hard, so mechanics like lifting weights, chin-ups, pull-ups, things like that, hence the name. Golfers commonly get this. It's still much more common to see tennis elbow with golfers, but golfers do get this frequently. If the swing is biomechanically sound, it will typically be seen in the lead arm. At impact, the wrist tends to be a little bit more flexed. In the trail arm, the wrist is more extended. So when we're more flexed at impact, we get a lot more contraction of the muscles here, and that can cause irritation. So diagnosis of this in the office is very simple. We check the muscles for knots, pain, push on the bone, see if the bone is inflamed. We're going to check all the way up the lower extremity into the neck. Any irritation of joint, nerve in the neck can complicate this. As I was saying for tennis elbow, I don't think I've treated someone with one of these elbow conditions and they don't have some issue going on with the neck. So we're gonna check the neck for joint restrictions, trigger points in the deep muscles in the neck. We're going to check shoulder for adequate range of motion in all directions. Check the wrist for proper motion there as well. Treatment-wise, we're gonna do chiropractic adjustments or spinal manipulation for wherever we find our joint restrictions. So lots of times neck, upper back, upper ribs in here, shoulder, occasion if that needs to be adjusted. We're gonna do dry needling to the muscles, deep muscles in the neck to kind of reduce irritation of any nerves in that area. We're gonna do trigger point dry needling to any of the trigger points we find in the muscle group down here. In more stubborn cases, that focused shock wave works exceptionally well around that bone area. So that's gonna help mobilize stem cells to the area. It's gonna decrease inflammation. It's going to actually stimulate new blood vessel growth. So tendons, tendons are what attaches muscle to bone. Tendons do not have good blood supply inherently. So this is going to help to stimulate more healing in that area. And then we always need to be doing some kind of exercise for this. So not only at the elbow itself, but at the shoulder, maybe some thoracic mobility kind of things of that sort. So similarly to the tennis elbow exercise, there's another exercise you can do using this flex bar that I went over last time. We just need to modify it a bit to make it more specific for the muscle group that is involved with the golfer's elbow. So how we're gonna start with this. Now this one, in my opinion, is a little trickier than the exercise for the tennis elbow. So if my golfer's elbow is on the right side, we're gonna grab the flex bar with the affected hand. We're gonna flex the wrist, so we're gonna point the wrist up. That has to stay in the flex position. If you're going through this and you're here and then we do the other stuff and you're losing it, then you're not gonna be doing it properly. So we gotta make sure that that stays flexed. Then we're gonna use the other arm, reach over the top. So this elbow is gonna be kind of pointed straight up. We're gonna grip here and then we're gonna rotate, twist that flex bar that direction. So boom, we're gonna reach over and then we're pulling it this way. So we're gonna end up with both elbows tucked in the side. This wrist, right one, still nice and flexed. We straighten, and then we're gonna slowly release the right wrist into extension there. Okay, so let's start flexed, reach around. We're gonna twist. So both elbows are at the sides. and we straighten. And then we slowly release the affected wrist down. There. And then what we're doing is we're not only strengthening the muscle's ability to kind of shorten, which is a concentric contraction, we're also lengthening the muscle, so we're keeping it kind of contracted as we stretch it. And that's a very effective way to treat muscles. Develop strength, but also to heal tissue and things like that, because it loads the tendons much more. Same reps and sets as the tennis elbow. So it would be, you're gonna do 15 repetitions, so 15 of those in a row. Take a minute break and then do that 3 times. And then you're gonna do that every day. Some mild pain is permitted during the exercise. Pain probably should not be getting worse during it. And then the next morning, judge your response to it. If you don't have any increased soreness, you just continue with that. This bar, this green one, is the medium level resistance. There's a blue that's stronger. I think this one would suffice. I would actually probably start with the red for myself. So you probably don't even have to increase the amount of reps or sets. You can just, get the thickest bar available. And yeah, that's it for golfer's elbow. If you have any questions or anything, shoot down below. Like if you enjoyed the video. Thank you.